Hi, so today I'm going to be talking about selective serotonin reuptake inhibitors, or SSRIs. First of all, we need to discuss what is an SSRI. An SSRI, or selective serotonin reuptake inhibitor, is a drug used to treat anxiety and depression. Some examples of SSRIs, which are common, are Lexapro, Celexa, Prozac is a very common one, and Zoloft is also a very common one. Now we need to discuss how does an SSRI work. So, an SSRI, or selective serotonin reuptake inhibitor, stops the reuptake process of serotonin in the brain, hence the name SSRI, or selective serotonin reuptake inhibitor. As you can see in the picture to the right, this is two neurons, and the gap between them is called a synapse. So when you take an SSRI, it blocks the serotonin channel, which causes the synapse to fill with more serotonin, which amplifies the effect of the serotonin. So serotonin is a neurotransmitter. What is a neurotransmitter? A neurotransmitter is a chemical messenger in the brain. It helps send messages between neurons. When the brain sends signals, it releases a little bit of these neurotransmitters so that signals can be sent and delivered properly. But sometimes people don't have enough of these neurotransmitters, or too much of these neurotransmitters, which causes depression and anxiety. The process of replacing the neurotransmitter with new neurotransmitter is called the reuptake process. And like I said before, SSRIs block the reuptake process, causing serotonin to build up in the synapse, or the gap between the two cells, causing an amplified effect of the serotonin. So why is this needed? There are many different causes of depression, such as a chemical imbalance in the brain. This is the one that I'm going to be focusing on today. So, chemical imbalance in the brain where not enough serotonin or too much serotonin is secreted by the neurons in the neurotransmitter serotonin. This causes the mood to be unstable, and when there's not enough serotonin, people experience depression or anxiety. And the picture to the left is just the chemical makeup of serotonin. So, like I said, when people experience depression, they're most likely experiencing that because of the lack of serotonin or the excess serotonin in the synapse in their brains. So the effects of alcohol use when using SSRIs. This is very important to understand because many people do take SSRIs, and many people, while they're taking SSRIs, do tend to drink. Here are some quotes. According to the 2019 National Survey on Drug Use and Health, 85.6% of people ages 18 and older reported that they drank alcohol at some point in their life, and 69.5% reported that they drank in the past year. Another quote is that 12.7% of people aged 12 and over, and 8.6% of males and 16.5% of females took antidepressant medications in the past month. So this does overlap. A lot of people are taking SSRIs, and a lot of people are using alcohol. So it's important to understand the interactions between those. Some interactions are worsened symptoms of anxiety and depression, increased risk of negative side effects from other drugs taken, slowed motor skills and cognitive abilities, which tends to happen when you drink anyway, but it's just amplified when you do take alcohol and SSRIs together, sudden personality changes, which also does happen when you drink anyway, but is amplified when you do take SSRIs and alcohol. because 1 drink is equal to 2 drinks, and 2 drinks is equal to 4 drinks. So that's the problem with SSRIs and drinking alcohol. You need to be able to regulate yourself, and it's harder to do that when you are taking an SSRI and you do not understand the interactions between the two. And then the last page is just citations. Thank you.